Good morning, or on Instagram. Good morning, Instagram. Dr. Trisha Pingel here. And good morning to Facebook. Just waiting for people to join on the live this morning. Piggy saying hello. Good old Piggy. Thank you to all of you yesterday that watched my live and heard about my little scorpion sting. As you can see, my hand is moving today, which is nice. It's completely numb. I can't feel anything, but at least I can actually move it today, where yesterday it was like a tetany. So nice to have the movement in my hand back. Thank you to all of you that were. Piggy's gonna say bye and go chew a bone. Bye, Piggy. Here you go, Pig. So it's nice to have everyone care so much. Scorpion stings are a bugger, and I think I can type today, which is a start. But yesterday was rough. So what ended up happening, from what we can tell, is it was a bark scorpion, and it stung me on the wrist right by the nerve, and that is why my hand was unfunctional yesterday. Pretty creepy. So I don't have much over on Instagram this morning. Where is everyone? Am I too early? I'm gonna give it a moment. Facebook is definitely here. Good to see you guys. How you doing today? Right? We got a few more coming in. Bear with me, guys. I know I'm starting a little bit early, but my topic is great today. I'm gonna talk about autoimmune disease and how stress impacts autoimmune disease for people that already have autoimmune disease or for people that are predisposed to autoimmune disease. And autoimmune disease covers a wide range of people. So I'm sure many of you in some way either have an autoimmune disease or know somebody who does. And the severity of these diseases ranges so much, yet there's really only one common treatment. Piggy. Well, Piggy's testing the volume today. So I want to talk a little about, from a naturopathic perspective, about autoimmune diseases and how stress plays a role in that. So that's our topic today. Kind of fun, right? I think many of you, there were a few people on Instagram that asked for this topic. A little quiet over there on Instagram this morning, but oh well. We'll dive in here in just a second. So nice to have all of you join. All right. How do you treat scorpion stings? Yeah, you don't. That's the problem. So I was stung in the middle of the night around 1 a.m. It was under my pillow, which apparently is very common in Arizona. I've been in Arizona for over 20 years. This is my first sting. Now, my husband had been stung, so I kind of had some sort of idea. And as a doctor, in Arizona, you learn about how to do that. But really, you don't do much of anything. But I will say, here's what I did. And I'm not saying that this is standard treatment or anything out there, but I used apple cider vinegar, and Piggy. I used apple cider vinegar in a wrap, like a poultice around the hand, and that definitely helped with some of the stinging feeling, but I was unable to move my hand. So I did use some essential oils, rubbed them in, like ginger and cinnamon, some of the anti-inflammatory oils to kind of help. And then by the end of yesterday, I finally took an ibuprofen because it was so incredibly painful. But really, that's all you do, unless you have anaphylaxis of some sort, and then you have to go to the hospital. Hey, Pig, none of that. All right, so let's dive in, guys. Pig's gonna be a little bit of a bear today, I think, but that's okay. All right, so, hey, Pig. Oh well. All right, we're gonna talk about autoimmunity. I am Dr. Trisha Pingel, and this is your morning checkup. Welcome back, everybody. I am happy to be here and happy to have some function in my hands, so yay. All right, so our immune system is there, right, to protect us from invaders, viruses, bacteria, you name it. It's there to be our defense. And I did do a live on the immune system in general. So for some of you that missed that, definitely head back and check it out. And I do have some articles on that on my website, drpingel.com. But it's there to protect us. It's kind of like an army. So if an invader comes in, you neutralize the threat. And a lot of that has to do with an inflammatory response. So when I was stung by my scorpion yesterday, my body inflamed, right? It inflamed to try to fight the invader, the neurotoxin that was injected into my hand. So that's what a healthy immune system does, okay? However, in people with autoimmunity, what happens is the immune system is too heightened all the time. So it's not only killing invaders, it's killing healthy cells. And depending on where that occurs, what type of autoimmunity it is, then, you have different symptoms. So you could have, somebody with Hashimoto's, it's attacking the thyroid. Someone with lupus, it could attack the lungs, it could attack the kidneys, it could attack the joints, it could attack the skin. Rheumatoid arthritis typically, is looking at certain joints, not all joints. So it's even very particular about where it's going to attack, okay? But what it is an overactive immune system. So the common treatment in conventional society is immunosuppressants. So you suppress the immune system so that it doesn't attack. However, that then opens the door for other invaders, right? So when people are on these immunosuppressant medications, they can be more likely to have other infections that sneak through the door, right? And we don't want those. So that's one of the side effects of the medications and why people have to be so careful when they're on these immunosuppressive medications. Other types of conditions that have immunosuppressant medications would be things like cancer, chemotherapy, things like that. So obviously they act in a little bit different way when it comes to the autoimmune steroids versus the cancer steroids in many ways, but in many ways also similar. Okay, so it's suppressing the whole immune system. It's downregulating the whole army, not just the army that's attacking the thyroid, for example. It downregulates the whole body. Does that make sense? So that's where some of the holes come in treating autoimmunity, is that pretty much everyone's treated somewhat the same, but the varying degree with different autoimmune diseases is so vast. I mean, everybody kind of has to be treated individually, in my opinion, in order to really get a hang of it. So we're going to talk a little bit about that. We're also, because you all know me, we're going to talk about how stress exacerbates autoimmune disease. I don't think that's argued in many medical communities. I think stress definitely has an impact on the immune system, and it's well documented. So we're going to talk a little bit about that. Hello, people on Instagram joining in. Nice to see you all. Sorry, I'm a little bit early for you guys today, huh? I also left my coffee on the coffee maker. Bummer. But that's all right. Okay. So I see some people over on Facebook who are on different immunosuppressants medications. Yeah, and there's a lot of side effects, right? Yeah, and sometimes you have to weigh the good and the bad. I mean, sometimes you don't really have a choice. If you have severe joint deformity, you can't have an active life without sometimes a medication, right? But there's a lot of other things you can be doing in addition that also slow the process or help with the symptoms. And so that's what I want to talk about, is more the integrative approach to autoimmune disease today. Okay? Hello, Kelly. All right, so let's talk about what triggers autoimmunity. So it's very commonly known that the environment plays a role in the development of autoimmunity as well as genetics. So this is a genetic plus environment type area of medicine. They're learning a lot more about the risk factors of autoimmune diseases, but some of the risk factors that have shown up in PubMed studies are things like ultraviolet rays, secondhand cigarette smoke, pesticides tend to have some sort of role in putting people at increased risk of autoimmunity. Now, the word risk is an important one, right? We all have risks, right? We could get in our car and drive to work and we risk getting in a car accident. You go for a hike, you risk getting a snake. You go to bed, you risk getting stung by a scorpion, right? I mean, all of us take risks in life. So the word risk is kind of loosely thrown around. In autoimmunity, it's believed that there's a predisposition to it, whether that be genetic, although I've seen some with seemingly no underlying genetics for an autoimmunity, develop an autoimmunity. So I'm not saying it can't happen, but there's typically some sort of duality there. There's a genetic and an environment component. So if you can reduce your risk of exposure to certain things, it's theorized that you will also reduce your risk to developing autoimmunity or worsening the autoimmunity, if that makes sense. So that's kind of what we're going to talk about today. There is also something called drug-induced autoimmunity, most commonly drug-induced lupus, which comes from a side effect of certain medications. Now, some of these medications are very common, okay? Antibiotics, high blood pressure medications, a lot of those can cause this drug-induced lupus, often resulting in some sort of strange rash or joint pain. And then when you remove the drug, it goes away, right? You can even get a positive ANA, and I will talk about an ANA, so bear with me. You can get positive blood value while on these drugs and then take the drug away and that'll go away. Isn't that crazy? Yeah, so a lot of things can trigger, but it shows you that having something internally or some sort of toxin or change in the body can actually make a difference in autoimmunity and autoimmunity development, which is pretty fascinating. And I'm so happy as an alternative medicine provider, I guess, or naturopathic provider, I'm so happy to see this starting to show up in research, because ultimately as they continue to research it and they continue to develop, hopefully that will give even more of a wealth of options for those with autoimmunity for treatment. And that would be great, because I can say some of my most frustrated patients are those with autoimmunity, right? It's frustrating. It's hard, okay? It's up and down. Every day is a little bit different. And so to have more viable options for you would be stellar. So I'm really happy to see that. In fact, this is a cool study, guys. So there was a study that was done in Sweden, and it was recent, and it was published in the Journal of American Medical Association, okay? And it looked at just over 100,000 people who had been diagnosed with stress disorders. So things like post-traumatic stress disorder, adjustment disorder, you know, such like that. So they had some sort of stress adjustment disorder diagnosed, okay? And over 100,000 people. Then they also looked at 126,000 siblings of those patients, okay? And then they also looked at more than 1 million people who did not have the diagnosis of stress disorder. So you had the 100,000 with the stress disorder, the siblings, about 126,000, and then 1 million with no stress disorder diagnosed, okay? That was the study. They found that those stress sufferers, that first 100,000, were also at increased risk for not only one autoimmune disease, but multiple. They were at increased risk for multiple autoimmune disorders. And they had an even higher likelihood of autoimmunity if they were younger. Crazy. But in addition, follow me here, guys. Follow me. This is crazy. So the people who had PTSD and they were taking antidepressants, so they were taking like an SSRI, something that kept serotonin at a balanced level, had lower rates of autoimmune disease. So what does that mean? That means that neurotransmitters from the brain, such as serotonin, play a role in autoimmune development and maintenance. So if you have a more balanced brain neurochemistry, you will have a lower likelihood of autoimmune disease, right? Now, we've spent a lot of time so far talking about that. What about the links between probiotics and gut flora on serotonin? What about that gut-brain axis when you're under stress, how your gut inflames and breaks down? So there are a ton of research on the gut and the brain axis and how they communicate between the flora and the neurotransmitters. So if a balanced serotonin is showing us lower autoimmunity risk, then doesn't that also infer that gut health is going to play a huge role in that? It's not going to hurt, right? And that's why probiotics are often recommended for people with autoimmune disease. Not simply just for general health, but because there's a connection between the gut and the brain. Now, someone mentioned that they have fibromyalgia. The number one treatment for that is antidepressant therapy, right? Now, there's tons of side effects to antidepressants as well. So that's kind of a risk-benefit type situation. Do you take it? Do you not? That's kind of an individualized discussion between the patient and the doctor, deciding what the best benefit is. But it goes to show you that by managing neurotransmitters, you manage the autoimmunity. So how can we apply that to a naturopathic perspective, right? And that's where a lot of the stuff that I'm talking about, it just takes some extrapolation. Somebody asked yesterday and they were like, can you tell people what to do, or what do you do about the legal ramifications of this? Look, I'm not telling you what to do, but I'm asking you to look at the data and extrapolate and have a conversation with your doctor about what you can do, okay? Because there are links to bacterial flora and autoimmune disease as well, also documented. But it's kind of opening up an area of research that is really quite cool, right? This is way cool. Way cool. Jim saying fight or flight can cause autoimmune disease. Yeah, bear with me, Jim. That's where I'm heading, man. You got it. You're right on the train. That's exactly where we're going. So they found, so that's pretty cool, right? I mean, they found that if you had a stress-related disorder, the people in the study were 36% more likely to develop autoimmune disease. 36%. That's a third. So just apply that to the numbers of people with autoimmune disease, and a third of them, probably at least a third of them, have some sort of stress overlapping disorder. Okay? Okay. Stress and autoimmune disease. So let's go into it, as Jim just suggested over there on Facebook. And Piggy's starting to bark at stuff again. So sorry, Pig is on a roll today. I don't know what her deal is. I let her play with a ball before this, and that was probably my mistake. So here's the question. So there's obviously this implied link, or this link starting to show up in research about stress and autoimmunity, okay? But why? Okay, and that's what we're gonna talk about. Why would that be? Pig, quit scratching at the door, girl. Or come say hi to the people. So it could just be cumulative life stressors. I mean, all of us have life stress, right? I mean, financial, we've got a pandemic stress, we have, kids. My son just turned 12 yesterday. That's a whole nother level of stress. Becky's asking about MS. Yes, that would fall into the category of autoimmunity. But we also have internal stressors, okay? We have things like diabetes, obesity, heart disease, things inside the body that are causing stress. And the hard thing about autoimmunity is once you have autoimmunity, right, that's also an internal stress. So it just keeps it going. So stress is a huge part of this, okay? But why? Here's a stat that is crazy. And actually, even seeing this in practice, this stat blew me away, okay? And it came from a published study. This is not made up, okay? This came from PubMed. It's a peer-reviewed journal study. 80% of people who have been diagnosed with an autoimmune disease report that they had significant emotional stress right before disease onset. So they went through something, whatever it may be, that caused stress on their body, and then the autoimmunity developed. 80%. Now, knowing the rates of autoimmune disease out there in America, many of you watching right now have autoimmune disease. And that means that many of you, 80% of you, can link it to some sort of stress in your life or some sort of stressful environment in your life. That is insane. Am I alone? That's insane, right? Totally. Yeah, huge thing. So, why? So we've talked about stress a lot because that's what I do, right? That's my job. But the sympathetic nervous system is activated when you see stress. So I often use this analogy, you're in the woods and you see a bear and your body reacts to the bear, right? So the bear is that fight or flight response. It's that endorphin release, right? So when you release cortisol and epinephrine and norepinephrine, that's your fight or flight response. Now during fight or flight, just for quick review, recording has stopped on Facebook? Really? Really? Can someone verify that on Facebook? I was riding a roll there, man. I still show it going, but we're gonna just keep going. Worst case, I'll just repost it, okay? So that fight or flight response is where we run. Okay, we run from the bear, right? We don't rest and digest. We don't repair our immune system. We don't digest our food. We don't absorb the nutrients that we need. We don't clear our liver. So I just sat here and said that autoimmunity plays a role with toxins and chemicals in our environment. So if we're not resting and digesting, we're also not clearing chemicals. We're not detoxifying the body. We're not absorbing nutrients. Thanks to everyone verifying. Glad to hear it. So that's very important that we have that rest or digest time. So when we're focused on a bear all the time, if we have stress coming at us from external sources or internal stress, such as some of the diseases I've spoke about earlier, or even autoimmunity that's ingrained, right? That's causing more stress and less rest, okay? So it could be anything from work deadlines, teenage drama, financial woes, to obesity, diabetes, high blood pressure, right? These stresses are there, okay? So that fight or flight affects the immune system, okay? It affects the way that the brain and the body communicate in regards to what a threat is. So if you are in the woods and you see a bear, your body has to determine that that's a threat. If your body is constantly having to assess threats, right, then your body has to determine what's more important. And that becomes a problem in autoimmunity because the brain and the immune system don't really know who's the real threat, right? Is gluten the threat in a celiac, or is it influenza, right? The body has to make a determination. Oh shoot, which one's more important? I'm going to attack the intestinal cells because gluten's here all the time, and it could miss influenza and it could walk right through the door, right? So there's all these different things that can happen, and you start to attack normal cells, okay? And that's a miscommunication. How that happens progressively over time, okay? Initially, your immune system's a little bit more on point, and then as you go along, it becomes less and less on point, and that develops into autoimmunity, particularly if you have the genetic background and the environment background to back that up, okay? Hopefully that makes sense. On top of that, I know, I just keep going. I just keep going and going and going. But on top of that, we just talked about serotonin and neurotransmitters and the gut health axis in regards to autoimmunity, right? So if you're under a lot of stress, that impacts the way that you digest food, the way that your bacterial flora are balanced. We've talked about that before. And serotonin is produced primarily in the gut. There's also a direct connection between cortisol and the production of serotonin. So what makes serotonin? Amino acids, vitamin C, B6, B12, all of these B vitamins and vitamin C, which are depleted under chronic stress. So you lose, my Instagram account is at Dr. Pingel. Leah, you'll find me, but I will repost this. Anyway, you've got all these links. You've got nutritional deficiencies that play a role in the development of low serotonin. You've got, gut flora that communicate with the brain, that the gut then communicates back and says produce more or less of this. So certain bacteria produce certain excitatory effects, and then certain bacteria produce certain inhibitory effects. And if they're not communicating, you've also got inflammation coming from the immune system. So all these things react together, and it's very, very important. So autoimmunity, the reason why I believe, in my opinion, it can be so difficult to treat when you put everybody in the same box is that everybody has different levels of stress, different results from those levels of stress. So one person may have plenty of vitamin C, but not enough vitamin B6. So if you give them vitamin C, they may not have as good of a response as if you gave them vitamin B6, right? What are they eating? What's their lifestyle? So there's so much individuality that goes to each autoimmune client, okay? So when that happens, it's harder to treat. And then when you go on the conventional route, everyone's being treated with steroids or immune suppressive medication, and that may not be the right fit for everybody, maybe only some, right? Or maybe there's modifications that need to happen in the middle. That's what makes autoimmunity so difficult. And that's what makes the community online of people who have autoimmune disease so vast. I know there are many of you out there that gather together, that search, that find people with your autoimmune disease because it is so hard to find clear and concise information. And in defense, there's so much information to consider that sometimes it's hard to give clear and concise information, particularly when you're looking at studies, because you have to fund all those individual studies and you have to find a group of people that all have exactly the same presentation. Find me 2 autoimmune clients that have exactly the same presentation with the same lifestyle, the same nutrient deficiencies, the same severity. You can't find that person. Okay, so very hard to do large studies on this. The best way to do studies on this is through cohort studies and following people over periods of time and looking for trends. And when you find those trends, you kind of start to adapt treatment per person. And that's, someone keeps bringing up vitamin D. Vitamin D is huge in autoimmune research, but then again, what's the right level? And how do we absorb it? And how much is your exposure to sun? Hard to tell. Does everyone get the same amount of vitamin D? Right? See what I mean? Good point, right? Tons of research on it though. right? Positive. So this is how stress causes a problem, and this is why treating autoimmune disease is so difficult over time, and why an integrative approach, in my opinion, is essential. So if you have an autoimmune disease and you simply just have the immunologist working on it, I would highly suggest you find an integrative medicine practitioner in addition, or some sort of naturopath or functional medicine doctor to work with them. Okay, not against them. I want to be clear. Don't want to work against them. I want to work with them, right? We want to work together and find an answer for each individual person, okay? So I have seen, and maybe this will give some of you some hope, and this is just general. This isn't a research I'm quoting. This is just me watching people, okay? Watching my patient database. So I'm just giving you a general overview opinion here. I have had people who have come to me with positive ANA, which is anti-nuclear antibody, which is usually 98% of the time, if it comes back positive, there's some sort of autoimmunity. Now, there's still a couple percent that may have autoimmunity that it's not positive, okay? But in general, it's thought if you have a positive ANA, you probably have some sort of underlying autoimmunity. Now, that autoimmunity could be anything, okay? It could be Hashimoto's, it could be lupus, it could be rheumatoid arthritis, it could be celiac disease, it could be ulcerative colitis. The list goes on and on. It's not definitive. Okay, so typically this is how the process goes. If you go to see a rheumatologist, for example, and you have an ANA and it comes back positive, then it reflexes to all these other markers that indicate which autoimmune disease is underlying. Okay, so I have had numerous patients, and I'm trying to think of an exact number. I mean, I would say, I don't know, it might have been like 20% of my kind of autoimmune database, although this is always an evolving thing and it seems to change regularly. But I will have someone come positive with an ANA. We make some lifestyle changes, some nutritional changes, and their ANA goes negative. Now, they still have the autoimmune disease, but their symptoms are less because it's not triggering that. So I have seen an ANA go up and down in people a lot, where it's positive and then it's not, and then it's positive and it's not. I've seen other people who had pretty significant, one patient in mind who had pretty significant lupus, and her ANA has been negative for years now with just nutritional therapy, and she's not having the symptoms that she was having before. Now, is it gone? I doubt it. Is it in remission? Possibly. Do we need more research on this? Yes. But what I have seen is changes in lifestyle, nutritional therapy, and looking at the person individually makes a huge difference. Okay, that's my point. Makes a huge difference. So what do? We should talk about that. I'm missing my coffee right now that I left on the coffee maker, and my water. Kind of a bummer. Unfortunately, Piggy has little paws. She can't go get it for me, but that's all right. Number one, lowering stress. Now that kind of goes without saying. It's not always possible though, right? I mean, you can't always stop the external stress around you, okay? The stress may remain, but how you internalize that stress, you can, okay? So we've got the difference between external stresses and internal stresses. So external stress would be the things outside that are having an impact on you. Okay, internal stresses would be those that are happening inside the body that are now causing stress. So if you already have an autoimmune disease that causes stress, diabetes would cause stress, imbalance of flora or brain chemistry, medications, blood pressure, all these types of things that are not, that are out of range or are not in homeostasis can cause stress. Okay. External, we can do a lot about that. I shouldn't say we couldn't, because of course we can. You follow good diet, you follow good exercise, you work on the recommendations to live the healthiest life you can, and that internal stress will go down as well. Externally is what most people think of when I talk about stress, but don't ignore the internal, okay? Don't ignore it, right? Women that have gone through menopause, how stressful is that? Right? The internal hormone fluctuations are a total pain in the butt, right? And they cause stress. Now, can you do a lot about that? Yeah, you can help manage it. You can balance it out, but sometimes you just have to go through that process. Like you have to look at each individual stressor individually. Externally though, what can we do? I talk a lot about gratitude, reframing. I firmly believe that every perceived failure is an opportunity to grow. We all fail. I've failed numerous times. I've fallen flat on my face, and I've had to stand back up find the good in it, and turn it into something that's positive for me. It's very difficult to do when you're in the throes of stress, when your life is falling down. It's very hard to get up and say, okay, this is supposed to happen. What am I supposed to learn from this? That's one of the hardest things to do because it's so easy to fall into that depression of that, especially if gut flora and other stress have impacted the chemicals in the brain. If you have low serotonin and you have high levels of norepinephrine and epinephrine, sometimes it's really hard to reframe because you get caught in that internal stress, right? Do you understand? Internal, external, they go hand in hand. This is not individually. You got to look at the internal stress and you got to look at the external stress. But if you can find it within yourself to pick yourself back up and move forward, it will lower over time the way that external stress impacts your body, okay? And it's still hard for me at times. Now, I had something happen recently that was very hard for me to come to terms with. It took me a few days to just kind of be like, all right, you know what? This is the way that the world is moving. This is the way that I have to, that the door, there are other doors opening that I need to see because there's a door closing. And as much as I maybe thought it wasn't the right time for it to close, or maybe I thought it wasn't the path that I was on, it wasn't what I was planning, the door closed. It just closed. So the question is, is there another door opening when that door closes? And trying to find that silver lining is key. Okay. I know that was a lot of talk on that, but I think it's a really important one. Like, how many of you really have a good, strong handle on that aspect? It's hard. I've been doing this for years and I still, this was a recent thing that happened and it knocked my butt down and it took me about 3 days to stand back up, and that's okay, but I got back up, right? Look for those open doors. That makes a huge difference. With autoimmunity, coming back to that can be very difficult because sometimes the prognosis or the risks and the benefits are very scary, right? They say, well, we can give you this medication that will improve your joint pain and deformity, but now you're more likely to catch other diseases. And then, like a pandemic such as this happens, and then you're wondering, well, what do? Do I stay on the medication and protect my joints, or do I come off the medication in order to bring my immune system up to avoid getting sick? Nobody knows the answer, guys. I don't know the answer, It's hard. When you're in that arena of autoimmunity, it's very difficult. And I feel for everyone with autoimmune disease because it's very confusing, okay? So try to just look at how far you've come. And when a door closes, look at other doors you can open. And keep moving forward. That's my best advice on how to handle external stress. In addition, regular physical activity, breathing, remembering to breathe, meditation, things like that are always incredibly helpful, okay? Calming inflammation. So I've seen many of you saying, oh, well, my inflammatory markers go up and down. Yeah, so that's very common in autoimmunity. You're looking at inflammation. It's considered successful when the inflammation is lower, right? So how can you lower inflammation without medication? Now, I'm not saying don't take your medication. I'm just saying, what are the natural things out there that you can do that assist in lowering inflammation, okay? Plant-based anti-inflammatory diet. I will definitely do a live on this because I've had a lot of people ask questions, but I do also have an article at drpingel.com on what that means. There's a bunch of different varieties. When it comes to autoimmunity, the most well-documented and well-studied is a paleo-Mediterranean diet, meaning that you're reducing your grains down to mostly ancient grains or gluten-free grains, and then primarily plant, nuts, seeds, vegetables, fruits, and then if you so desire, a little bit of wild-caught fish or grass-fed poultry. But it's not a heavy meat-based diet. It's a heavy plant-based diet, plant and oils. Okay, very, very important, most well-studied. I would say that's probably the best studied diet for autoimmunity is a paleo-Mediterranean. If you want to look that up, paleo-Mediterranean diet. That's usually takes dairy out as well, okay? And they do drink a little bit of wine, so there's some positive. Not a lot now, folks, not a lot. But calming the inflammation through diet is very important. Calming the inflammation through external sources is very important. And aiding your digestion. If you're not getting the right nutrients, we've already said how stressful that is on the body. So you must be getting the right nutrients through your food. If you have autoimmunity of the gut, celiac, ulcerative colitis, Crohn's disease, that's going to cause inflammation and it's going to cause nutrient deficiencies. Okay. When you get nutrient deficiencies, guess what, folks? More stress. Okay, so looking at the digestion, the inputs, the outputs, incredibly important. I say this so many times. Look at infants. We care what they eat, when they ate, whether they went to the bathroom. That's what we care about, and whether they're sleeping, right? I know as a mom, when my babies were little, that's what I cared about. That's what we should be caring about too. Are we sleeping? What are we putting in our mouths? Is it coming out? Are we okay? Is everything coming in and out? That's what we need to pay attention to. That keeps inflammation low. That keeps our cells healthy, okay? So realize this also, and this is a very important point that I'm sure I've banged on 1,000 times throughout this video, but individuality, biochemical individuality, treating each autoimmune client as each autoimmune client. They are not all the same. You are not all the same. I'm not the same as you. I can't find anyone else like me. Now you find someone else like me, introduce them, right? I can't find anyone else like you either. Everybody is different. And although we have a general base requirement and a general base need to drive reactions forward, we all have a little bit different toxin level. We all have a different environment. We all have a different outlook. We all have different genetic predispositions based on the generations before us. So we have to look at all of these when we come to comprehensive treatment. And autoimmunity is one of the areas that I feel we are lacking in general in that. As far as in the conventional medicine side. Now, integrative medicine is a beautiful area here. So I really encourage you, go seek your area out for an alternative or integrative or functional medicine or naturopathic doctor that can work with your doctor to come up with a customized plan. Let one side work on the diet, the lifestyle, the stress management, the nutrition, and let the other side, decide whether the medication can be modified up or down. I mean, there's so many options out there. There's also a ton of research on this, guys. Do your research. There's a ton. Definitely make sure you're taking a good probiotic, okay? And make sure that you're supporting your gut health and you're taking a look at your inputs and outputs. All of this will help you become less inflamed and hopefully have a positive impact on your symptoms. So yeah, I have a lot of you out there today, huh? Nice to see you all. Thank you. Thank you for showing up. This is Dr. Trisha Pingel. This is your morning checkup, and today is Thursday, the 14th. We still have another day tomorrow. I'll be here around this time tomorrow with another topic. Not sure what it's going to be yet, but I will be here, and hopefully you will be here as well. And for those of you that have had some streaming issues, I always repost these, okay? I repost them on Instagram and on Facebook. I also post them on my YouTube channel. So if you're really having trouble with some of the social media sites due to a large variety of people, I repost these. I'm not hiding them, so you can go back and you can take a look at them, okay? Hey, thanks for joining, guys. Thank you so much. I hope you guys have a fantastic day. If you like this and this was beneficial to you, tag, like, share. You guys have been great at that. It's getting the word out. I get more and more people joining every day, and it's my pleasure to be here for you and to give you some education. So thank you so much for being here. I really appreciate it. You guys have a great day. Thank you so much.